Are we ready? Good evening and welcome to the March 14th Board of Directors meeting for the Escambia Children's Trust. The meeting is being called to order at 5:31. We would like to ask everyone to please turn off their cell phones and set them on silent. If anyone has any public comments, we have a public comments forms located at the table to the left of the podium. Please fill one out and give it to one of the ladies over here. First, we would like to welcome and introduce Judge Todd Harris. Welcome.
Thank you very much.
And if everyone would like to go down the line and introduce themselves, please.
Hi, I'm Walter Sachs. I'm representing Department of Children and Families. I'm the Family Wellbeing Director for the Northwest and Northeast regions. My delegate, Melissa Sidoti, is on leave this week, so I'm sitting in for her.
Having made the trip from Tallahassee, and we thank you for that. I'm Rex Northup, the board members, former pediatrician in the community, and had been the medical director of an organization called Children's Medical Services for this region for over 30 years, as well as working in the PEDS ICU at Sacred Heart Hospital for a similar time period. And welcome, Judge.
Tim Smith, Superintendent of the School District.
Welcome, Tori Woods.
Patty Hightower, School Board Member.
Stephanie White, attorney.
David Peden, appointed by the governor. That's our seats. There's 5 of us, so, yeah.
Ms. Alma, would you please take attendance of the members present?
Tori Woods.
Present.
Ms. Hightower.
Present.
David Peden.
Present.
Dr. Northup.
Present.
Dr. Smith.
Present.
I have Melissa Sidoti as out. And tell me your name again, sir.
Walter Sachs, S-A-C-H-S.
Thank you. Commissioner May. Stephanie White.
Here.
Judge Harris.
Present.
And Pastor Wesley. All right. Ladies and gentlemen, in front of you, you have a Board of Directors manual. This is something that we've been working on for a while. It's going to have a lot of information there at your fingertips. I will tell you, probably after tonight, we're going to have some updates to the committees. So I'll be bringing that in and let you update your binder at that time. And then I'm still working on the bylaws, getting it blessed by legal, and then we'll have that for an update for you.
Thank you. Dr.
Does Melissa have hers, or do I need to bring hers? Okay, thank you.
Dr. Northup, would you please lead us in the Pledge of Allegiance?
Or stand with me. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you.
Thank you. If everyone has had time to review the agenda, may I get a motion to approve?
So moved.
Second.
All in favor?
Aye.
Aye.
The agenda has been approved. Moving on to the minutes. Staff recommends the board approve the minutes from Part 2 of the January 10th, 2023 regular board meeting as presented. Is there a motion to approve?
Move to approve as presented.
Second.
All in favor?
Aye.
Aye.
Minutes from Part 2 of the January 10th meeting has been approved. Staff will recommends the board approve the minutes from February 14th, 2023 regular board meeting as presented. May I get a motion to approve?
So moved.
Second.
All in favor?
Aye.
Minutes from the February 14th meeting have been approved. Next, we have the board reports. Mr. Peden, would you please present the treasurer's report?
Sure. Thank you, Madam Chair. We have our first audit that was completed recently, and it's on, I believe it's on our website. I think all the board has been presented a copy of it. We have a clean audit report relating to our financial statements. However, we have a finding related to operating in accordance with our policy manual for background checks and maintaining separate bank accounts for payroll. I believe the policy manual has been updating and bringing us into compliance with the background checks. We were waiting on from the state to get approval, and I think we just gotten that recently, within the last few days even. So we were waiting on that. It's not a major issue, and the issue with the maintaining a separate bank account for payroll has been updated with our policy manual as well. At the time, it didn't match up, but we were working through the process. But right now, it's all good. So if anybody has any questions, okay, it's on our website and can be viewed by the public. And also in your packet, you see our financial statement. And also on the website, it's got various bullet points about the financials for the month. If there's any questions, we'd be welcome to entertain any questions with that. If not, Madam Chair, we'll just accept it as presented and move forward.
Thank you.
Madam Chair,
Yes, ma'am.
I just want to reiterate that we need to be very careful and do proofreading. In there are a couple of things in the bullets themselves, particularly the 5th bullet. We have to make sure we get THERE and THEIR correct.
Yes.
And it's just a matter, because our computers do it for us, but they don't always get it right. So be sure we proofread it. We are an association that wants to put forth our best efforts.
Thank you for catching that. Are there any public comments regarding the agenda items? Mr. Lou Timothy May? I just wanted to state that there is a 3-minute time limit, and Ms. Alma will start the timer as soon as you start speaking.
Sure.
Thank you.
Thank you so much. Thank you, Madam Chair and the entire board. I simply came to just commend you for the work that you do, and I see the headlines of some of the negative press that you get sometimes, but I'm one of those constituents that want to come and share, the positives that you do. I know you have a lot of hard work that goes on before you, and I read something that said that, you're not doing your job as far as getting the funding to disadvantaged youth and young people. And I was in a conversation with several people that have done a lot of philanthropy in the community, and I said, that's not true. There's several schools, there's several nonprofits that I help behind the scenes to give them just tips on how to put forth best grants. And several of them won the grants, several of them didn't. But many of those kids are disadvantaged children. One, I can speak on A. Dixon. The other one is Benny Washington. And there's others that you really are hitting the marks. And I want to commend the staff, because this is not the time. I mean, many times you don't hear positive remarks. You always hear the people that's complaining. I didn't come here to complain. I wanted to come thank you for all of your volunteerism, all of your hard efforts, and it is reaching the students that you have, the taxpayers wanted it to hit. And again, that's all I came. I'm not going to use 3 minutes, but one of my meetings earlier today canceled, and I said, why don't I go down there and just be a cheerleader for people who are volunteering their time to help our community be better? And that's all I came down here to tell you guys. So keep up the good work. And of course, is there any way that I can help behind the scenes? That's what I love doing, and I'm going to continue to do it. I will say staff, I've called staff. They return my phone calls. They return emails. I didn't want any fanfare. I just wanted to know, how could I help? And they pointed me in the direction of other nonprofits that needed our help, and we helped behind the scenes. But I do want you to know publicly that there are a lot of people that appreciate the work that you're doing. So thanks again so much.
Thank you.
Thank you.
Miss Mary Ann Biggerstaff?
Mine's actually a for action item.
Okay. So So we're moving on to our action items. Under business, we have Mr. Peden speaking on the notice of termination of Anglin contract. Mr. Peden?
Yes, thank you, Madam Chair. We hired Anglin, Anglin when we first got started, and with our contract, we have to give them due proper notice, and this does that, put them on notice that we will be canceling their services. Since we have a full-time accounting on staff with Tammy, it's time to cut the cord and move on, but we appreciate their work throughout this process. They've been a great help to us. So I'll entertain a motion to terminate that contract.
Motion to terminate the contract of England.
Second.
Any discussion?
Madam Chair, I would like to just thank Tammy and Board Member Peden for the due diligence in making sure we're being efficient with our funds and we're not paying expenses where we don't need to, and for staff taking on that role. I think it makes us a little leaner and a little bit more efficient. So thank you all for that effort and your attention to detail on this.
Thank you.
Madam Chair,
Yes,
I just
ma'am.
want to say to the Anglin company that we appreciate the work that they did, because we needed them, and they stepped up, and probably one of the reasons we have a good audit report is because of their work, so I appreciate that.
I second that. I got to work with them, and they were great to work with, so.
Thank you. Any other discussion? No discussion? All in favor?
Aye.
Any opposed? The recommendation has been approved. We now have Ms. Tammy making a recommendation with regards to the check signers.
Yes, with the election of the new officers, we need to remove the old officers that were check signers and have Tori and David both set up as check signers for our bank account. So this resolution will be for me to take to the bank to get that done.
I move the approval of Resolution 2023-02, authorizing the replacement of board officers on the bank accounts.
Second.
Do we have any discussion? All in favor?
Aye.
Aye.
Any opposed? That recommendation has also been approved. Next we have Dr. Northup making a recommendation on the Help Me Grow program. So public comment before this? Yes. Okay. So before she makes that, we need to have public comment. Is that correct? Because we have one public comment. Yes. Okay, sorry. Before you, Dr. Northup, Ms. Mary Ann.
I'd first like to start by echoing the sentiments of Reverend May. I know it's not an easy job that any of you are doing. Spoke before you a few months ago when we were just processing forth the strategic plan, and actually touched upon this line item that's before you tonight, and I'm so excited to be addressing that. I am here to speak in support of the proposed invitation to bid of the Help Me Grow Collaborative. My entire career of 37 years has been devoted to providing early intervention services for infants and toddlers with developmental delays and diagnosed disabilities at the Art Gateway Pearl Nelson Center. I began as an infant and toddler developmental specialist, traveling to homes to provide those services directly to children and their families. While today the Art Gateway provides services to more than 1,200 children and adults with intellectual and developmental disabilities in our community, we began as a parent-led grassroots organization founded by Mrs. Pearl Nelson, who had a son with Down syndrome. There were no public school services in 1954 when she established our organization, so she took the initiative to create services because she knew her son, Chris, could learn and be productive. We are the boots on the ground direct service providers of early intervention services for Escambia County. We have an agreement with the local Early Steps program at Sacred Heart, Ascension Sacred Heart, who holds that contract with the Department of Health Children's Medical Services Early Steps program at the state level. They also have independent providers who provide those services directly under them with direct contracts. At our program, we provide developmental instruction services, which are provided by infant toddler developmental specialists, and those services are provided wherever that child and family are. It may be at a child care center, it may be at grandma's house, it may be at Chick-fil-A in the community to help a parent be able to help their child adapt to those surroundings. We help the parents to identify their concerns and their priorities, and then to develop strategies that will help promote their child's development and their daily routines. Not that it be homework, but that it be fun activities that can help their child develop upon the developmental progression that all children experience. We also provide pediatric physical, occupational, and speech therapy services, both in the homes of children and at our center. In a little bit, I'll share with you about some of the challenges, but the majority of those services do have to be provided in the center because of a critical shortage of providers, so that we want as many hours of indirect services rather than traveling on the streets. Over the past 6 months, we have provided services to more than 600 children, with 70% of those being ages birth to 5 years of age. We are familiar with the brain research, as I'm sure all of you are, that we have heard so much over the past 25 years, that emphasizes the importance of intervening in those first 3 years of life when the brain is most adaptable for change. In my experience over the past 37 years, there are 2 primary challenges. Okay, thank you.
Thank you. Dr. Northup?
I believe that Ms. Tammy has a presentation, some information for us, and then I will be available for comment and certainly for questions or anything as well. Ms. Bickerstaff, thank you for the work, the tremendous work that you and your team have done for so long, and that this program serves to augment, complement, collaborate with, to hopefully expand the impact of those services.
Madam Chair? Ma'am?
Yes.
I am curious. You said there are 2 major challenges and you weren't able to finish, but I would like to hear what those 2 major challenges are, if I could just.
Sure. The first has been the under-identification of children. We know that 13% from all the research nationwide, 13% of infants and toddlers should have developmental delays and disabilities that require these services. In Florida, we're serving 5.7%. I don't have the exact numbers for Escambia County, but Early Steps has promised to get that for us. But you can see we are missing more than half of the children that we should be identifying. The second is that the funding that flows through the legislature, is approved by the legislator, has been the same for the early intervention developmental instruction component since they started the oversight in 1996. So if my salary was the same since 1996, I'd be homeless. And then our Medicaid rates for providing services, the physical, occupational, and speech therapy services, has been the same since 1989, except for about less than 5% increase during that time period. Again, it makes it hugely challenging, and it's why I have partnered with other collaboratives in the community to try and bring forth some solutions. We actually proposed the solution of Help Me Grow to initially achieve Escambia, but there were no funding dollars to make that happen, and look forward to the opportunity to put forth a collaborative proposal with our partners in the community for this invitation to bid if it's accepted by the board and approved.
Thank you.
In follow-up to that, and prior to Tammy's presentation relating back to that Underachieve Escambia, they brought Dr. Dworkin, the founder of this program nationally, here to Pensacola in 2017, I believe it was. He presented one of our pediatric grand rounds to the pediatric community at that time, and then spent the rest of the day doing some additional discussions and conferences and things throughout the community in an effort to try to get this implemented. So it's been kind of fomenting in the community for the last 6 years or so, and finally getting to a point that we may be able to do something positive about it.
So I'm sure that many of you are already familiar with the Help Me Grow model, and we sent out a bunch of information, but I just wanted to give you kind of the high-level overview and give you an opportunity to ask any kind of questions that you may have, because it is a pretty complex system that we're trying to build here. So wanted to start, first of all, with a strategic plan so that you could connect the dots. This was one of the services that we had put down as a tactic, and it was to be rolled out in the third quarter, so we're right on target with that, with our current strategic plan. And it is a comprehensive system. So I know some people refer to it as a hotline, and that is just a teeny tiny piece of this big initiative. And then, as you'll see when we move through this, ours will be different from some of the other models in the state because we want to include the services piece. This is hard to read on this big screen. It's not that bright on my screen, but basically this shows what it is, and there are different components. And the first big component is about screening. And right now, we don't do enough of that. I think Marianne did a great job talking about the need for additional screenings. There's data that we'll get into a little bit later on, but something that came out, there was a report that was issued just this, was it this week? I think it was just this week or last week from, it's the Hetchinger report. And it says that Black toddlers are 5 times less likely to receive services, early intervention services, than white toddlers. So there's a huge disparity there. And I'll show you later on some of the data that we found for Escambia County. Early intervention evaluation, so there's an initial assessment. There's an indication that, yes, there may be something going on with this child. So then they're referred to get a full evaluation. So that could be by an occupational therapist. It could be by a physician. A lot of times your referrals don't originate on that phone line with the coordinator that this would be to fund. A lot of times it originates with the pediatrician, and then they send the patient, or the parent rather, to the system so that they can come in and receive the case management and all the wraparound services and all the connections. So I'm going to use the word system a lot because that's really what this is. So then matching them with the appropriate services, that's an issue if you have a Help Me Grow program, but you don't have enough services in place. You don't want to create more demand when there's already a limited supply. So one of the things that we really want to do with this is we want to put the bulk of the funding that the board set aside in the strategic plan for this initiative, we want to put the bulk of that into services, and we want to really concentrate those services to make sure that they're accessible for children who are birth to 3, because the earlier you intervene, the better the results, the better the outcomes, the more likely they are to be ready for kindergarten and academic success moving forward. I'm not reading all of this to you because you all can read this. So then there's early intervention, and there are a list of things that it addresses. So it's physical skills, cognitive skills, communication skills, daily living or adaptive skills. So if they're going to Chick-fil-A and they need to know how to interact at Chick-fil-A, social or emotional skills. I get on my soapbox a lot lately about social media because of a lot of the things that we're seeing. Children don't know how to interact with other human beings anymore because they're put in front of screens all the time. So that's a really important component too. And if you have a developmental delay and then you couple that without the appropriate supports and the interaction, it can result in behavioral problems when they hit the K through 12 system. So why Help Me Grow? Because there are other models out there, I'm sure, but as Dr. Northup pointed out, this is something that has been percolating in the community for a while, and Help Me Grow is a national model. We did not make this up. It was created by Dr. Dorkin, who is a pediatrician. He saw the need and created this program. And what they found in Florida is that for every dollar that you invest in a Help Me Grow model, you get a $7.62 return on investment. And I really like the idea of getting a return on investment. So what does it do? What does the Help Me Grow model do to meet the needs of the children and families? Again, coordinated system. So there's screening and service delivery, intensive resources for families. And I think that's something that we really need to highlight, is the fact that this will also include education and outreach to families so that they not only understand how to identify a potential delay with their child, when should the child be crawling, when should they be speaking, and when should they be using full sentences, when should they be learning letters and colors and numbers and all these things, so that you can identify if they're meeting their milestones. So we have to get that information out to parents, and we have to have a system to support them. So there's the education piece, there's the outreach piece, so that they know what resources are available. So it's more than just someone answering a phone and saying, call this other person over here. It's to create a feedback loop so that when they do make that phone call to a pediatrician or to an occupational therapist, then the Help Me Grow staff then sort of act like case managers. Well, I guess they really are case managers. And then they follow up and say, were you able to reach them? Were you able to go to your appointment? Did you have the transportation that you need? Did you have the paperwork filled out? So you have this whole system, almost like a navigator specific to this target population of children. Also, and you can see on here, it fills in the gaps without costly duplication. So you see, as you have one entity coordinating all of this, you start to see what's missing and what's duplicated, and try to help to allocate the services so that you don't have the same core group of kids getting all of the services. Everything gets spread a little more equitably. Guides families through free developmental and behavioral screenings. That's the screenings versus the evaluations. And then provides parenting tips and activities and other useful information. So not only are you giving parents tools, but you're teaching them how to use those tools with their children. So this is just a nice visual that shows how all those different pieces fit together and make a framework for children's healthy development and well-being. To tie it back to our core indicators, the ones that are circled are the indicators that this program ultimately will impact. So it's everything from infant mortality, if you have a disability that is not diagnosed early enough, all the way across the board to school arrests and referrals to law enforcement, because if they're exhibiting some kind of behavior and that's related to a disability or a mental health issue, then if you had those early interventions in place, then that child's going to be less likely to end up in the criminal justice system in the long run, because they've gotten the supports that they need. So then the numbers, for those of you who are data people, Kim, do you want to run through the numbers, or do you want me to do it?
Absolutely. So this is, we have 3 data slides. This is current gaps in services for young children who are underserved or referred too late, how they show up in our county data. This is the statistic on students with disabilities from this current school year, pulled from Know Your Data portal, and we ran these in support of this ITB for information for the board. So all Escambia County students with disabilities, that number 16%. It's always good to have children behind that number, so that's 6,061 students, up from 15% before the pandemic, compared to all Florida students with disabilities at 15, also up from 14%. That's interesting, right? But it doesn't really tell us that much. So we wanted to pull where those children are, and we pulled all the elementary schools with populations of above 15%. Of students with disabilities, so that we can see the majority of public school students with disabilities attend these elementary schools, and included Hope Horizon too, because they have quite a few elementary age children. So ranging from 100% at Judy Andrews down to 15.7% at West Pensacola. Now this doesn't necessarily correlate to neighborhood level services because of choice and how the district strategizes services for children with disabilities, but at least gives us a snapshot of where those children attend school. Another interesting data point, speaking to the disparities that Tammy mentioned, is in this chart. It's a little much to look at, but what it's showing you is Looking at that 16% of children overall with disabilities in Escambia County Public Schools this year, what we do is look at that disaggregated by race. And we can look at Black students, white students, and Hispanic students. Those are the three groups that are the dominant groups in our district, where we can pull disaggregated data. Then we can look at all of that by grade level. So pre-K is VPK, kindergarten, first grade, second grade, and third grade. And we can see how those percentages of students with disabilities by race and age group show up compared to their total population in the school. So Black students are 34% of the total enrolled population. They're 42% of the third grade students with disabilities. So that's the disparity that we want to fix. This is our baseline. This is the number that we want to turn around.
May I ask a question? These are the identified students, correct?
That's right.
Okay. I just wanted to be sure, because Ms. Biggerstaff was talking about how many are not identified. So when we're talking about this, we're talking about those that are already identified.
And what this shows is how great a job the school district is doing in identifying children, especially those who are undiagnosed. But what we want to do is slide that up in the critical birth to 3 years so that they're not getting a diagnosis in third grade.
So again, just to give you an idea how this would look, the system coordination piece, we're estimating that about 250,000 may go for that piece, and that's not just staffing. That would be staffing, and if they needed to travel within the community, if they needed to print information for parents, all of those kinds of things that would be something for the lead agency themselves to use. That includes the benefits for their staff who are working on this and everything. The bulk of the money, at least 1.4 million of it, could go straight to the direct services for children birth to 3 who have a need for particular interventions. So the way this would look, if you read that very large document that was included in your packet, we have everything in SAMUS, so that this will be the first application that can be done online, which we're very proud of. And we've beta tested it, so we're hoping that it'll be very smooth application-wise. But the way that it would look is you would have one lead agency, so there would be one contract with the Escambia Children's Trust. That lead agency would do the coordination and would hire the Help Me Grow staff that would do the case management and the outreach and work with the physicians and work with the providers to pull them into the system. But then they would also subcontract with different providers to push the money out for the direct services. So that is, in a nutshell, what we had for the Help Me Grow, for just the kind of overarching description. And then Dr. Northup is really the expert, so I will turn it over to him.
This is one of the areas in pediatrics within Northwest Florida that, if anything, over the last 30 years, I reluctantly have to say that we've perhaps lost some ground. We had years ago, back in the early days with the DEI clinic and things, Dr. Debbie Goldberg, who has offered to be one of our reviewers, was very active with that. Dr. Melissa Picardi was a fellowship-trained behavior and developmental pediatrician. She subsequently retired. We went a number of years in the community, and then had Dr. Kay Lewis, who was here for a number of years at Children's Medical Services, providing a clinic for these children. And then subsequent to her, Dr. Gina Gargis, who has also regrettably retired. We just had some conversations with Sacred Heart recently. They are very actively recruiting. Nearly, they thought, had another behavior and developmental pediatrician set. These are entities who are few and far between. by specialty and by training, but they are continuing their efforts to actively recruit in this area. The pediatricians in this area, this program would serve to complement, augment, work collaboratively with them as they work to identify, as Ms. Bickerstaff has said, more of these children. It was not uncommon when I was beginning my training back in the late 70s that these children would wait until they became kindergarten age and got into the public school system, and then were identified, parents knowing all along, or certainly for some time having suspicions that their children, and fortunately individuals like Ms. Pearl Nelson, who said we can do better than this. And that's what this is about, is doing better with the services that we already have here, working to identify through data collection and other things that will be part of this program to look at where we can do better, where we can put resources, try to augment the services and the providers that are present in the community so that more of these children can not only be identified, but then have some interventions brought into place so that by the time they enter the public school system, they are much more on track and with their peers. I am going to make this extraordinarily personal. My niece, Cameron Northup, was one of the recipients of some of the services available through the Art Gateway and the extraordinary individuals there, and the difference it has made in her life in 2 days. She will have her 37th birthday, by the way. She is licensed formally through the state of Florida as an esthetician, having been the first graduate in the state of Florida with special needs to accomplish that on her first pass, I may say. And all of that reflects back to the fact that in her early childhood, she received these diagnostic evaluations. She then got plugged into the services. And one of the other huge things that this works to do is works to empower the parents that long after they have outgrown this 0 to 3, 0 to 8-year-old range, those needs continue. These parents are far more adept and skillful in interfacing with the system of care that Tammy has talked about developing with the public school system, with the providers and others, to see that their children continue to get these services that they need and they benefit from, and that this is a huge step in that direction. And I am just obviously all in favor of it and think it would hold promises to children throughout our community, throughout the county. From Century, I was up in Century just Friday talking with Dr. Miriam Stewart, pediatric provider up there. She is just ecstatic about this and talks about the need, as Ms. Bickerstaff has alluded to, for the various therapies. Even once these children are identified, that these therapies would be in place and these services would be in place. And this is the type of thing, as Tammy has said, that the vast majority of the funding that we've allocated towards this concept would be going directly to those service providers and make those services available and more available throughout the entire county. So with that, I'll hush and open to any questions or other comments.
I have a couple questions. Thank you so much, Dr. Northup. I know y'all have worked hard on this. My question is, what about the kids that are already on the waiting list? How does this, are we helping provide for more providers? There's a ton of kids I know on a waiting list for Art Gateway, for Pearl Nelson, for all the therapies. And so we're going to find new kids who, I talked to you on the phone about 2 kids who needed services last week, so how do we get them moved up to the list? Are we going to move them up? Are we going to just add new providers? How does this help everybody in the system?
Well, and I will certainly be interested in hearing comments from Ms. Bickerstaff as well. But yes, the intention will be that certainly over time, that there will be funding that will go towards direct services, will go towards the providers of those services. And then, as I say, part of it will be looking at those people on the waiting list. What is the cause of that? One of the things, for example, Dr. Stewart talked about, she knows of several children up in the Century area, that she said if we could just get providers into the cantonment area, that would make a huge difference, that trying to get from Century to cantonment is tremendously, not easy, but easier and more able to be accomplished than it is trying to get them down here to town and things. So that we recognize that we do not simply want to identify more children and add to that backlog, that part of it will be working with physician champions that are identified through here. We've already got a couple of those identified, working with other therapists. We've been in conversations, as I say, with Sacred Heart throughout their system of some of their urgent care centers and other outreach centers, of ways to try to get those therapists and those services closer to the kids that need them. And that is something that they have committed to working on with us.
But I guess but our money is not going to provide for another doctor or two, or is it?
At this point, it would not be at the physician level.
Okay.
It would be at the provider level of the therapists and these other providers that we've got the identification. The pediatricians have identified the needs. The
So like
therapists,
physical therapists and speech therapists, occupational
Speech,
therapists.
occupational,
Gotcha. So
et
our
cetera.
money will help with that.
Yeah,
yes,
that's the 1.4 million from
correct.
the slide.
Okay, I was reading and I was looking for, I guess that's core component number 5 is what that goes to.
Yes.
And the rest, 1 through 4, is the 250,000. The telephone number, the marketing, the put stuff on social media, that's the core component 1 through 4.
And helping with some of that actual care coordination
Okay.
and facilitation. That's another thing I was going to take on a little bit of a connected, intertwined entity is the directory that we have worked on developing. I will tell you that in my time with Children's Medical Services, and I was responsible for all 10 counties in the Panhandle from the Apalachicola River over, that one of the most significant things that we got the most consistent positive feedback from parents, from caregivers, non-parental, as you are very familiar with the providers themselves throughout that area, was a revised and updated directory of services available throughout the region. And some of those services were outside the region. They had to do over with Gainesville or some of the other areas that they went to. But that those families quickly became very proficient at utilizing that directory, asking for the newest copy of that directory, using it to access services. And that was one of the things, as I said, that went along with this education, where they became very, very strong advocates of getting on the phone with their care coordinators and saying, my child needs to go see this therapist, and I know they're available in Defuniak Springs, or they're available over in Baker or wherever it might be. And they just, you talk about taking their directory from them or something, or noticing when they'd come in it was worn and pages falling out, to give them a new one. And they'd say, well, I'll take your new one, but you're not having my old one, because they had so many notes written in it and things. And it was extraordinarily helpful to the care of those children and the empowerment of those parents. And Ms. Bickerstaff, other comments that you may add?
Some of the conversation that I've had with our partners in the community, not with all the early childhood care providers, is that we recognize this critical shortage of providers. Actually, at Pearl Nelson, we've had to stop accepting referrals from physicians recently and put a pause on that, which breaks my heart because that is not early intervention. And so a component of this would be being able to fund some outreach to build that capacity to universities that are, within our traveling distance, and to other providers in the community who have already been providing throughout the state of Florida that we might be able to recruit to our area.
One of the things we've done in the past that would be a model, I would think, would be to look at again, was that I know it's Sacred having the Children's Hospital there and all. We had people from the University of South Alabama, various therapists that would come over, from Pensacola Christian College that had some students, and others that helped add to it was a win-win because the students were getting the educational component, and it was expanding our abilities, both inpatient and outpatient, to provide those services as well. And those would be the types of things that at least I would envision us looking at, and again, this collaborative model.
I'm booked with interns from University of South Alabama, Florida State University, University of St. Augustine, and University of Florida through 2024. Each semester I have interns coming. The problem has been, because the funding has been so restrictive from 1989 and 1996, that I haven't been able to be competitive. And so hoping that these dollars can help support that gap so that we could be more competitive and recruit professionals to our community.
I have an administrative type question about the length of term. From reading the ITB, it looked like it was a one-year commitment with a one-year renewal. And I guess I had a two-part question, is that, has there been any experience as to how long it takes a collaborative entity like this to form and become operational? And with the answer to that question in mind, is there enough time to even evaluate it for a potential renewal, or should we have a longer initial relationship, like a 2-year commitment with a 1-year renewal, to give the collaboration a chance to get its feet on the ground and do operations? It seemed it was a very tight window to potentially be evaluating them next spring for a renewal, when you may not have everybody fully in place and up and operational like you want it to be. So I didn't know if there's a historical perspective on these types of entities coming on, how long it takes, and two, is 1 year enough time to prove out the value?
I did not pay him to ask that question, but talk with me afterwards, and I will.
We actually had one of our early learning calls with Help Me Grow Florida staff, and that was actually their recommendation. I think initially we were conceiving of it as a 3-year, but to protect the trust in case the lead agency, that relationship doesn't work out, the recommendation was to put a 2-year cap on it. So that came from Help Me Grow Florida.
I would think all of our contracts would have early termination clauses that allow either party to go away at no cause, like 30-day notice, 60-day notice, whatever it is. So
Yeah,
you're
that's
always
right.
protected to walk away for no cause. But I just think, on its face, if you're asking someone to submit a budget and a proposal, there's recruiting, staffing, organizing that's going to maybe eat up 3 to 4 months of operations. Now you're down to 6 to 9 months of work, and that really may not prove out the value to decide on a renewal. So just a suggestion to move that to 2 years and then a 1-year renewal.
I will say as well that in some of the direct conversations that we had, including with Sacred Heart, that was exactly one of the points that they brought up by the time they talk about recruiting people, bringing them on board, training them, doing all those various things, and having a 1 year, or at most a 1 year with a 1-year renewal, was a mighty short time for a huge commitment on their part, and they I can assure you, be in favor of that type of a thing as well.
Madam Chair, I'm sorry.
Go ahead.
My question was for you. Anyway, Superintendent, does this have a direct correlation when you talk about the achievement gap that you talked about a lot in our school system? Is this like step one of helping that process?
Well, that's a great question, and this has the potential for early intervention and identification and intervention to support our children. There's an interesting piece of history with a European country that was very successful, and one of the things they attributed to their success with their school system was really identifying exceptional education elements in students, learning disabilities and so forth, and really getting out in front of that. And they put resource towards that, and their goal was to have those really under control in the first couple of years of public school. So I mention that because getting out in front and addressing at an early age impacts that trajectory of the student in their long term of educational experience. So I would say this program based on the framework, seems to have great potential to do that. And when we look at our kindergarten readiness rate, that's something that we really want to drive up to a higher percentage. So I appreciate that question. And also, I have a question too, more of a logistical question. The question is, so if I'm correct, physicians, a child goes to a doctor's appointment, and that's kind of where things begin to become identified. I concern myself with this with early learning and students going to preschools and daycares, and are we missing children in that process? So that's where my mind goes here. Are we missing students, missing children in this early identification? And are there some framework pieces to identify and to track?
And Kim, jump in here. So we've also included Bruce Watson and Vicki, who is leaving the Early Learning Coalition, but we have involved them in these conversations about the ITB and about the Help Me Grow model. And they very much want to make sure that the Help Me Grow is linked to their child care referral system. So they will help us push out all the information about the project and make sure that all of the parents who are bringing their children to the early childhood education centers all have this information as well. And I would like to see some training for the providers, for the early childhood educators, so that they can also help to identify potential delays in the educational setting. And then also to work with the parents and to give access to the parents. And Bruce has actually indicated that the Early Learning Coalition may even be interested in applying as one of the lead agencies, but they will certainly be part of whatever collaborative is formed. You can't really do this without some key partners, and those key partners typically are your Early Learning Coalition. You have an organization like Art Gateway at the table. Children's Home Society gets involved in these in some communities. You have a map of all the different affiliates in your packet, and we have it online for anybody who wants to check it out on our website. You have Early Learning Coalition. You also have 211. You have United Way that needs to be linked to this. That's a very small piece of it, but if someone needs information, then 211 can put them in touch with the Help Me Grow coordinator so that they get pulled into the system too. So, so to answer your question, yes, the Early Learning Coalition and all of the programs that they fund and Head Start, all of those organizations will be looped into this system.
Just to build out that list, it's at the bottom of page 19. One of the required components is organizing an advisory board, the Help Me Grow leadership team. This is part of the national model. So it's in the ITB at the bottom of page 19 is a list of
19 of 45.
Yeah, 19 of 45. So that's the Help Me Grow leadership team. The Children's Trust does have a seat at the table, as they do in the other counties that have a Children's Services Council and a Help Me Grow affiliate in Florida. And then to your point, Dr. Smith, there's a requirement on page 28 of 45 to host a minimum of 2 family and community outreach activities every single month. And then at least 2, what Help Me Grow calls books, balls, and blocks, community-wide screening events, which can be at churches, parking lots, pop-up tents, back to school, drives, you name it. Wherever kids are is where these screenings need to happen. And so that's some of the minimums that are built into family and community outreach. You can't do Help Me Grow without touching families. This is the #1 thing.
If I may piggyback on that, Dr. Krupa, I think that is an essential component where it really caught my eye during the presentation about families being resourced and some parenting sessions to help and support parents as they're raising their young children. So I appreciate that piece because I think there's a great opportunity to help a lot of parents and resource them and support them.
Madam Chair?
Yes, sir.
Thank you. I apologize. And so, obviously, it's a great need. So I think as we look at what funding should be for a Children's Trust, it should not be to replace existing funding. So I would want to know, where have we lost the gap? I mean, we have, certainly I've been on the phone since I read the agenda. When we look at the Studer Institute, what they're doing with early brain, when we look at Children's Services of how CHS is funded, when we look at United Way, Success by Six, Early Learning Coalition, we look at Head Start. And so what does this bring that's not currently existing in the services that are provided? I mean, what's the new service that's going to be provided that's not being provided for children from 0 to 3? And so I would like, that would help me better understand it, because there are a lot of services in the personal philanthropy community that exists, and there's state money that comes to help children. And so, I mean, we shouldn't be replicating or duplicating funding for things that are already being funded. So, I mean, where are we missing the gap? And that would help me better support this. I mean, community health, do they get funding to do the same thing for prenatal and for early learning, for mental health? Children's Services, they get funding. The Studer Group gets philanthropy. United Way gets personal funding. And Early Learning Coalition, we've already funded them at the tune of almost $500,000. So what gap are we missing to fund this, to make this worthwhile?
Well, I think part of it, you are correct there. You've identified a number of potential puzzle pieces that would fit within this system of care, first of all.
Right.
Is what
Not potential, but they're currently funded. It's what I've everybody that I've mentioned are currently getting either private dollars, state dollars, or local dollars to provide this service for children, whether it's Head Start or whether it's early learning or whether it's whatever. They're being funded at this point. And so I would just like to say, what's the enhancement that we need? And I'm not saying I don't support it. I'm saying, are we enhancing it, or are we filling a gap?
Well, I think it's both. I think one, in large part, it's trying to coordinate that spectrum of services that you've described, which individually do represent, I think, significant parts of resources that are out there. They are at this time in large part fragmented. They are in large part hitting different parts of the county, particularly the metropolitan Pensacola area part of the county, which is a large portion of what you've described those services serving now, as opposed to the county throughout. They are also, in regards to the services that are provided to individual families, there's not a single source entryway, which is one of the major things that would be provided through this model here, is finding a single source, not so much provider, but a single source. I have issues or concerns about my child of that list that you just provided, which is very thorough. It is partial even in its listing, but it's, if I'm out here as a single young parent or even a family that has a child, or the situation that Stephanie and I were discussing last week of a single mom with a couple of children needing this, those things are out there. It's almost overwhelming of who do I go see, when do I go see, about what problem, what are my criteria for eligibility, et cetera, transportation. The list just goes on to the issues that, even as thorough as that is and as much philanthropy and funding as you describe, it is a complex system. It's extremely difficult to navigate. I would dare say Ms. Bickerstaff and her staff, I will tell you, after 35 years of being over CMS for this entire area, it was a challenge to know who, what, when, where, how, all of the above, to get a given child into that system to receive the services they needed in a timely fashion. the funding part of things, as you heard Ms. Bickerstaff and others have said, that there's tremendous need in regards to providers of these services. In spite of whatever philanthropy, state funding you allude to and otherwise, the needs far exceed what is there. Ms. Bickerstaff herself said that we're only identifying about half of the children that data and statistics tell us are out there in Escambia County. As we identify more, the need for those therapies, those providers, those interventions is obviously going to do nothing but grow. And one of my mentors, actually several of them, Dr. Reed Bell, John Whitcomb, and others, made the observation years ago, and I found it to be vastly true, that the needs, no matter what the resources, in pediatrics, the needs are going to essentially always exceed the resources there to deal with them. And the coordination of that and the ability to avoid duplication of services, the ability to identify pockets of need, the ability to identify providers of need, and these other things is a huge part of the data collection that will go along with this ITB that will allow us to begin to come along and take some of those providers that you've mentioned and to say, hey, your services are no longer needed in this part because they're being addressed by United Way, early intervention, whoever it may be. But we've identified a tremendous need over here on the west side of town. And we really need some people to work with us to meet those needs. And it's those types of things that I think right now, yes, there are lots of advantages, but there are a huge amount of gaps that are still there, and that this will help us provide some oversight too, and some coordination too, and build collaboration among those areas. And you know, in county government, things dependent on state funding, and I say this with Walter immediately to my left here, those are here today and hopefully maybe here tomorrow, but maybe not.
And thank you for the dissertation, Dr. Norton. And so I think that my point is that not the replacement of existing funding, but if it's enhancement, I mean, I think that's what it should be. And so you absolutely, we all fund unfunded mandates, but certainly if there are services that are being provided and being funded, this tax is not intended, as we all know, to replace it.
I want to just ask a clarity question if I could, because I think it's a very relevant issue. The direct services that are going to be funded through this arrangement, the decision on who receives those services will be by the collaboration, not by the trust. Is that correct?
That's the way I read it.
So when we contract with this entity, the obligation of fiduciary accountability, as the commissioner said, transfers to the entity who is handing out the money. And the decision-making about who gets and who doesn't get and the boundaries within that money being spent has to be governed by the statute that we're under, which is you can't supplant something that already exists. So the due diligence and the guardrails, all of the requirements that this entity has to follow have to be into a contractual bounding that we have to provide oversight to ensure they're staying within those boundaries, because that will be our only leverage to say you did or didn't award correctly. So I just would coach at this point that when the contract gets to its writing phase and we're actually scribing out the do's and do nots, we have to be very deliberate about our fiduciary accountability with these dollars. It can't be a misunderstanding. So that's more of a commentary than it is a question.
Madam Chair?
Yes, ma'am.
Okay, I had a couple of questions, and one of them has kind of been covered. When you list under C on page 19, these organizations, my question had to do with, are those the only ones? Because as Commissioner May was talking about, there are already organizations working in this space. And what I love about this particular opportunity is we have sat up here and talked about not knowing where services are provided and where the gaps are. And so this is an opportunity, in my mind, to get a group, a collaborative out there to figure out, okay, where are the gaps? Where are we, do we need more people up in Century? You know, when you talked about getting to Cantonment. And finding out, because one of the points also was avoiding duplication of services. You know, get everybody in the same room and talking together to figure out how do we get our biggest impact. If everybody's doing the same thing, we're not really going to be able to achieve that. So I just wanted to make sure that we would be talking to the Studer Institute and anyone out there. Of course, any of them may be going to apply. So, but that this is not an exclusive list of people, but this was a thought. And then because we've had conversations about a hotline, Ms. Greer indicated that that would just be a small part, and it would be part of the 211 system that's already in place. Is that correct? But these people would be trained in how to, if a parent called for a children's service, they would know who to contact, or whether they would send it to whoever's over the collaborative. Is that kind of what I have to get in my mind how it's working?
Right. You would have a Help Me Grow coordinator, which is kind of a case management initial entry point, if you will. And so when someone would call 211, then 211 is trained to turn it over, but it would be a warm handoff, not just here, call this number.
Okay.
They could transfer it to the Help Me Grow coordinator.
Okay, it's not, I'm giving you another number for you to call.
Right.
Okay, just
Patty-
wanted to make sure that.
Patty, if we could have a dialogue, because you're talking, and so we fund 211 through our outside agency funding, and it would be very disappointing if they were not already trained to do that. So, I mean, we fund that as a county. And so if they're, we're saying they're not trained to do that.
No, my question was, how is that handoff because if the person is calling to find out how to get in touch with ARC Gateway, I know in the school district, sometimes my frustration is someone will call and we'll give them off to a person, but we never know about the follow-through. And that was the other piece that I loved about this, that they're not only going to put that person in touch with a coordinator, but that coordinator, I heard, now I may be not listening right, would also be responsible for making sure if they sent it to this parent, that they got through to the provider that had been suggested to them, and that the service either was used or was not used for whatever purpose. Because I think we find that with our mental health services with the school district, when we provide something to a parent, we don't know whether that actually happened. We give them that. And so I think that's another piece that has been missing, is that if we have somebody coordinating and following up with the parents to make sure they were able to access the services that were suggested, I think that's a very big piece that will fill in those gaps. To your point also, though, we already have a waiting list. We know that people are not identified. How do we do that? What is in here that's going to help us, knowing the limitations, the obstacles of not having enough providers, but yet we want to make sure that we're identify them. I just want to make sure we're going at this in the right way. To Walter's point, do we is 1 year enough to get everything put in place? I think that as a trust member, I would be able to say, you're making way. I mean, we're not expecting it to turn over tomorrow, but I think that at the end of a year, we should be able to see something has happened and services have been put in place and additional children have been helped. But I just wanted to make sure I had heard all, let's see if I got everything. How do I go to the services? Oh, there was one other question on page 19 of it talks about in B, review monthly data reports, summary reports, and reports provided by the SCO, that's the state coordinating organization or something. Are they going to be doing data for Escambia County, or are we looking at state data here? I was not clear there on that, what that referred to.
We're going to be collecting the Escambia data.
Okay. But this sounds like something at the state level is going to be, but are they going to talk to you about the data you collect?
Do you want to tell them about the STAR system?
Yes,
Okay.
you might have caught this somewhere, but it's spelled out on page 30.
Oh,
We're
okay.
throwing
I
page
missed it.
numbers around.
Sorry.
System for tracking access to referrals is the National Help Me Grow database. So as part of becoming an affiliate of Help Me Grow Florida, there's a mandatory participation in this data sharing among all the subcontractors and the lead agency. And this bulleted list is just to Mr. Sox's point for this 2-year period. In additional years, we would want to measure actual child outcome improvement, so developmental progression. We actually want to see results rather than just kind of tracking the activities that would be part of the startup phase. And then the list is definitely not exhaustive. On page 19, we put including but not limited to the following. This is just pretty much a boilerplate list that would definitely need to be customized.
Patty, I just wanted to speak on a few things that you said. One of the things that stuck out to me about this program, because I do community outreach, that's what I do for a living. And one of the biggest things that my job, obstacles we have, is meeting our members where they are. And so I like the fact that they are required to do those monthly events, because one of the other things that stood out to me was them saying that Black toddlers are 5 times less likely to get services. I know that a lot of the times our members have travel and have, obstacles getting to different places, but there are certain places that they will be. And so being able to have someone going out to those communities and doing those, what did she say?
The screening?
Yeah, the outreach events and the mandatory evaluations, and going to the communities where they are, like even in Century or anywhere locally, being able to have someone to go out and do that is a huge obstacle. And I also like the case management part. Part of one of the things that they do for CMS is all of our CMS members have case managers. The issue, or not issue, but the obstacle for that is if you don't have CMS, you don't have a case manager. So somebody has to identify you for that CMS plan to have a case manager, whereas this is catching all kids and helping them before, or maybe where they might fall through the crack with CMS. Because I'm out in the community and I see a lot of our members or even people in the community that may qualify for certain services, but somehow they fell through the gaps. And the majority of that time is, those African-American families, also like going to your appointment. So if you're not taking your child to your appointment, then there's nobody to catch that issue. And speaking to Dr. Northup, my niece has, she's autistic. And when she was little, her parents thought, oh, well, she sat in front of her computer, the tablet, and she was quiet. And they was like, oh, that's good, I can work around the house. So sometimes our families don't know that sitting in front of a tablet and not speaking is not a good thing. But being able to go out into those communities where they are at sporting events, that's where I see a lot of our members as well. And educating them on those services, I think, is a great component that I see as a gap for a lot of families in the community. So just my background and thoughts on this program.
Commissioner, one of the other things I want to go back to that you had alluded to, I think is, I missed making this point previously, is that one of the hopes would be that over time that some of these philanthropic organizations, particularly that you had mentioned, would see the benefit of this organization, the Help Me Grow model, and would perhaps step up and help add even yet additional funding for provision of direct services in some of these other areas where I'm sure opportunities are going to exist, even in addition to the funding we're talking about putting out.
No, and that's fine, Dr. North. I mean, certainly, I've been a part of this from community impact to Bridges of Poverty to impact, the entire thing. One thing that's really happened with helping poor people, particularly poor people of color, is the creation of bureaucracy that creates jobs for people to enhance themselves, to create another level of bureaucracy without dollars going to direct services. And so I'm always conscious of dollars being taken and not being implemented into direct services. And so I'm not saying it's not a great idea. I just don't want to duplicate. I mean, I know the statute is very clear that if a service exists, that we shouldn't create another level of bureaucracy. And so that was just my question, and I don't even have an opinion of it. I just have to get a better clarification for myself. And so I agree with you. And so I've talked to many of these people that I just mentioned. Quite frankly, I've talked to probably 75% of them on the service that they provide. And so I want to enhance it if they're increasing capacity or deliverables, but I certainly don't want to replace. It's easy to take government dollars and replace what is existing, because we can always find room to increase staff. We can always find room to increase expenditures without increasing the deliverables. So that was to my point. And so you've clearly explained your position, so I certainly appreciate it.
Madam Chair?
Yes, sir.
So I tell you, it's on one side you hear this and it's great, and then the questions Commissioner May asked, then I start thinking about all these agencies and all the dollars that go into funding Early Learning Coalition or Achieve and everything we're doing, and we have these gaps. And so I'm thinking, is putting more money into this going to close that gap? And I look at you. For you being in this business, I trust your judgment. I know what you do at Pearl Nelson. So and I guess you're the only provider maybe that's here. Help me understand how we're not duplicating, and then why do we already have this gap issue when we've got multiple agencies dealing with this? And this is just for better understanding. I'm not being critical. This is, I just trying to learn more about this, because it's fascinating on one hand, but we've got to be prudent in what we're doing. But I don't understand why we're still missing it with everything we're doing in the nonprofit community.
A lot of what has been referenced by Commissioner May is some prevention programs. And what we're finding is that the actual intervention of those children who are identified with developmental delays, there's not enough services to meet those needs. As I mentioned earlier, right now, my wait list for speech therapy is over 100 children. For occupational therapy is 90-some children. So capacity, being able to build, being able to do outreach, that will bring more providers to our community for those children who have that direct service need is going to be significant. Another example, I was talking to the Early Steps team today, and actually through our Kindergarten Readiness Collective Action Network, we're having conversations with Studer. They're all at the table, where there are like 25 organizations where we meet monthly and have been actually giving information to the trust to say, this is what we need in our community and this is how we'd like to collaborate to make this happen. But one example is, you have to get credentialed to provide services. So you initially with Medicaid get credentialed with just Medicaid, and that happens in like 10 days. But then there's managed care entities in the community, and that is taking 3 and sometimes 4, even with TRICARE now, it took 4 months for my last occupational therapist to get credentialed to be able to provide those services. So one of the gaps there, while you've got these kids waiting, but when someone's not credentialed, I can't provide those services and have them paid for. So these dollars could be used to provide services in the gap until those providers get credentialed with the managed care entities and the insurance companies. That's just one example. There's also, over the years, Early Steps eligibility criteria has become more restrictive so that they are providing and funding services for fewer children. So children with milder delays where we can really make that significant impact are not being funded for services. So it would not be a supplementation. It would be some collaborative opportunities to reach that population of children and get some intervention taking place.
So with this grant, say if you were a provider, you would be able to hire enough people to get that waiting list down, so to speak? I mean, that's...
Yeah, it's a big piece of the outreach is going to have to be trying to recruit providers to our community.
Okay, thank you.
And David, and so absolutely, I mean, we have a plethora of whether it's, school readiness, whether it's early learning, whether it's Studer, ARC Gateway, CHS, community health. The reality of it is, if we do an assessment to be able to identify, which is important, so once we identify it, we have to be willing to say we're going to identify it, we're going to assess it, but we have to be able to say we're going to provide money for services. So, when you look at some of these kids who have mental health issues in the school district, their IEP may be worth whatever it is. It may be worth $20,000 at CA-wise or at Global. And so, so to just, we clearly have identified that we have a need in the community. And rather, I'm just not supportive of 211 or saying, oh, there is a problem without having a solution. And so I'm going to identify it, I'm going to refer them to where, and because here's what happens. You've identified that we have an issue, we have identified that we have a problem, we have identified that we have a need, and then, we send an overwhelming number to Studer and to the ARC and to the providers, and they say, you know what, you've identified it, where's the money to provide the service? And so I think that it all goes in tandem together, in my opinion. So just to identify it, we have an issue. We have poverty, we have, low educational achievement in Escambia County. We don't need any assessment to tell us that. We know that. And so I'm just saying exactly how do we tie all that together. I'm not opposed. I'm just saying as we identify this funding, how do we identify funding for the services? And so if this is all encompassing of services,
That's what the $1.4 million is. So the $1.4 million is the direct services for the therapy, for the services to fill that gap, correct?
I would say that if you
correct. The actual
if you
Help
talk
Me
to the
Grow.
service provider, if you talk to service providers, 1.4 would not even be a scratch on the scalp. And that's fine, but yeah.
We agree, but it's like the guy walking along the beach with the starfish and throwing them in the ocean, and it made a difference to that one. It's $1.4 million more than exists to deal with the issue today.
I absolutely understand that.
On the website that's entitled Help Me Grow Florida, there's, I think, 13 locations around the state. And I just looked at the annual summaries for each of them. None of them talk about services. They all talk about connecting and referrals and outreach and physician champions, and all of them talk about the Children's Forum, the Early Learning Coalition. None of them speak to a Children's Services Council. Are any of the other ones funded through a CSC to design them and build them like this one would be, or are these existing and the CSC adds money to it?
Both. So when there was money from the Children's Forum to fund a lot of these programs, and when there was money at the state level before it even went to the Children's Forum, you saw a lot of these pop up outside of the Children's Services Council system. Then the Children's Services Council got involved. Sometimes you would see a partnership with the Children's Services Council. In some cases, the Children's Services Council has backed out because they have different funding sources, philanthropists, fundraising, other grants. But Alachua's Children's Trust just funded their local Help Me Grow system. And so that one, I think, just started within the past year. So it's a mix. It can be done a bunch of different ways. But I will say this, we recognize early on, thanks to Dr. Northup, that it would not be a good service to our community just to bring in the coordination piece. There's a lot of value in the coordination piece, so we don't want to lose that. That is the Help Me Grow model. It's that services piece that is missing here. That's where we really need the help. So our model would be different from the other ones in the state because we would add that piece. There is an organization in California. They have much, much, much more funding than we do. But in Los Angeles, they have this program called First 5 LA, and they fund the services. So we would be doing a little tiny baby version of what they're doing in Los Angeles County, which has had very good outcomes. And again, Commissioner May, it would not be supplanting any funding. It would absolutely be supplementing and complementing the funding that's already there. I don't know any of the providers that we've spoken to who said, you know what, we're good, we have all the funding that we need, we're meeting all the need in the community. That's not, they need so much more in terms of services.
But they'll never say that. But I mean, and when you look at, the millions of dollars that come into Title I to help those kids, and you look at the millions of dollars that come in federal through Head Start, I mean, we will never be able to even match those type of dollars. So I understand that, but there's probably not going to be a nonprofit that will ever say that they've got enough money. I mean, so that's not a fair assessment.
But if the need was met, then the nonprofits wouldn't need any more money. But if you look at the data and the problems that we're having in Escambia County, and we've got to do something. We've got to try something different. Just to keep throwing good money after bad, I don't think is the way to go. And so this is something that has been proven to work. It's evidence-based. It's a national model. We're adding the services component piece to it because we want to really invest in the direct services, and that's where this came from.
So I guess for clarification, because he said he looked at the other models, where I think the component maybe some people may misunderstand is we aren't like the other ones because we do have the service model. So if someone looked at the other Help Me Grow programs and thought that we were bringing that only, it looks like we're just collecting data and identifying kids that there's no service for them, whereas this model that you're proposing is both. So you have the service component in addition to identifying.
So do we need to take a vote, or what's
Yes.
what are we gonna do now?
I was about to ask, any more discussion?
I just wanted to ask if we wanted to modify it to the term, because that would be the only, I think, question about any edit that would be done in a document. If it's going to get released tomorrow, then it wouldn't be fair to release it and then have to do an addendum if it could be fixed early. But I didn't know if the board supported doing more than 1 year.
I would make a motion then that we approve Resolution 2023-02, authorizing the trust to issue ITB 2023-02, Help Me Grow, with the modification of extending the term to 2 years with the potential of a 1-year extension beyond that. So I make that motion.
I will second it, but I need to, okay, so it's okay for us to have a resolution 2023-02 and the ITB 2023-02, even though they have the same numbers? Okay, just checking.
Was that a second, Ms. Patty? Second. Any other discussion? All in favor?
Aye.
Aye.
Any opposed? The recommendation has been approved. And now we have Dr. Kimberly Cooper with the recommendation on the ITB Review Committee members. Ms. Cooper?
Yes, thank you, Madam Chair. We definitely heard the board during our last solicitation that we needed to have the review committee members established at the very beginning. And we've received a few resumes from the community and are recommending that the board approve the following local subject matter experts to participate in the ITB proposal review. We do have a modification to this list. Unfortunately, Heather Lopez, who coordinates early childhood court, had to remove herself due to a conflict with her position in the First Judicial Court. So we wanted to replace her with another great candidate who applied to serve on the review committee back in the fall. And you should have Dr. Carla Thompson's resume in your packets. It's in yellow paper. Thank you, Elma. But Dr. Thompson brings extensive subject matter expertise, knowledge, and work with families in Escambia County, long legacy and generations as an educator, a principal, specialties in behavioral health. I think she'd be a great addition to the review committee. And you can look at her resume and decide that for yourself. We also have another PhD, Dr. Markley, who is now retired and is an early childhood consultant on the side, recently married. She was Dr. Goldberg and ran Early Steps at Ascension Sacred Heart for many years. And then we have someone who is not an early child development expert, which I think is a good rounding out the knowledge of this review committee. He is a public policy person, and he's a professional evaluator, and that's Robert Theed, who is an instructor at Pensacola State College. So those three community members, those three residents, plus board members. I know we've got Dr. Northup as our board liaison for this solicitation. I know Ms. Woods is also interested in being on the review committee. That would be 5, but we welcome any other board members who want to serve.
I'm gonna nominate Walter, so you drive back over from Tallahassee.
Make a motion to accept all the candidates.
Any discussion? All in favor?
Aye.
Any opposed? The recommendation has been approved. And finally, we have our Executive Director, Tammy Greer, to speak about the strategic planning contract. Ms. Greer?
Thank you, Madam Chair. So we received one bid under the ITB for strategic planning, and this would to facilitate the strategic planning for the next 3 years when we can get into a little deeper work. We have a strategic plan now that we did very quickly back in when was it? The summer of this past year. But we need to have a plan moving forward for the next 3 years. So we sent out the ITB to several different organizations and asked them if they would be interested in bidding. We also asked FACT, Michelle Watson from FACT, and she didn't submit a bid because she was getting ready for legislative session. But we asked Lynn Cunningham, who had worked with us before. We sent it to her, and she said that it would just be, the cost would be too high because of her travel back and forth for as many sessions as we would need to engage the community. We sent it to Wanda Taylor, thank you. I could not remember her first name, thank you, Tammy. We sent it to another consultant here locally, Wanda Taylor, who had done some work with, I believe she had done work with Head Start before, right? And so she was unable to submit a bid as well. So we did get one bid from ID Group. We took it to Finance Committee so that it could be vetted by the Finance Committee before we brought it forward. The Finance Committee did not want to make a recommendation one way or the other. They wanted the full board to be able to consider both of the options that were put forward. The biggest difference in the two options that the ID Group put in their proposal, which you all have the full proposal that they submitted. The biggest difference was on the second option. It does not have the stakeholder dialogue. So there's leadership dialogue, and there are definitions of what the different groups are in the proposal. But the second option does not have the stakeholder dialogue, which is up to 40 people. That's a line item in here. And then it doesn't have the creation of a landing page for the strategic planning process. So it's up to the board, of course, if you want to accept one or the other or neither of the options. But we did think that it was a really well-presented proposal and would help to guide us through so that we already know what the needs are. We have the needs assessment. We have the feedback of the community that we've garnered so far, but we really, really would like to engage the community more and say, okay, look, these are the needs that we've addressed. Here's what we've done so far. And then go into each of the districts in the community and do some sessions so that they can be engaged in the strategic planning process for us. Because now we really need to start doing the work to make sure that the community has a voice in what we plan moving forward, so.
So are you proposing, can you, I guess, tell us both of the options for us to have
Well,
discussion?
I think I think the next step is for someone to make a recommendation about one of the options or the other, and then the board can engage in conversation, discussion about it.
I'll move that. We make the recommendation or for, I don't, what is the more robust option? We need to go with the full option here, which I think is the first one.
It is the first one. is
So
option one.
option number one.
Yes, sir.
With the ID group.
Second that.
Any discussion?
I would like to chime in here. I think the reason I think it's important that we go with this full option is because that stakeholder input is a way for us as the trust to get a broad spectrum of input. And personally, I just think this step for us as a trust to take is vital. There are so many variables that exist when you look at our needs assessment and some of the statistics. And I think one of the things we have to be very cognizant of is we can do a little of a lot of things, but I believe we need to focus on some core initiatives that are going to change for the long term. When we really look at our community, what are those top 3, 4 difference makers that are going to have long-term effect? I think this strategic planning process is really important for us to go through that and think about what are those priorities. So I wanted to share that. Plus, I will tell you, the ID group, we work with the ID group at the school board, and we've had a very robust, very helpful strategic plan. So they have a track record for me personally. I've seen their work, their quality work.
Any other discussion?
I want us to have those community conversations. I mean, I think that is the piece that we have missed. Actually going out into the community and talking with them about what they see as the needs. I guess I'm not sure that we have to have a strategic planning group to do it. I think that's kind of where I am. We have staff that could, with the board, go out and do the town hall meetings and listen, and then then we look at strategic planning after we've heard from the community. But I guess I'm just trying to figure that out.
But Patty, isn't it my understanding that we did do that? We did dial sessions, we went out to the community and had those meetings. Have we not had those? I'm on the same page with you. I mean, I thought that we did that.
I didn't go.
No?
The board didn't, I attended some of them, but the board did not attend.
Well, it's bad stewardship if we issued out grants and gave out money and didn't get community input. It was my understanding that we did.
We did have sessions, but we did not have, the board was not fully involved in those sessions. right? We had
Well, if the
this-
board was not fully, I mean, staff was involved. and
Yes,
Staff
staff
would
was
bring back a
definitely
report.
involved.
So, I
Yes.
mean, either we outreach to the community or we didn't. And if we
Where-
didn't, then that is, in my opinion, a fatal mistake. I mean, because before we ever issued out money, we should have been meeting with community. And we said that we were going into these different communities to hear from the constituents. And so if that didn't happen, then quite frankly, I was misled.
It did happen.
So why are we replicating it if it did happen?
We also, our strategic plan currently was a one-year strategic plan, am I correct? What was that?
We reached out to the community with regard to the needs assessment. So the community was involved in the needs assessment. And then we have done informational sessions for each of the different solicitations that we've released. What we haven't done is pull them into the strategic planning process, which is a whole separate ballgame. So what this would do is allow the community to have a say as to which of those needs are the most important, and should we say, you know, this is the model and we need to issue an ITB, or should we do a solicitation where it's just an open RFP, or is it an RFP for some kind of specific group of programs? Those are the kinds of things that we need the community to weigh in on in those strategic planning sessions.
May I ask a question? I knew that you had done those things, and those are different from what I'm discussing. So my question is, if we get a strategic planning organization, if we were to go with ID Group, we're not going to go through the needs assessment again. We've determined the needs assessment. What we would be going out and asking is, of the needs, we've already addressed one part of a bucket. Are we looking to the community to say, that was the right place to start? You didn't start in the right place. We need these things. Because again, going back to listening to the community about where they see their greatest challenge. Tori is fortunate because she gets out there. I get into the schools, but, you know, I'm not really out in the community in the way you are. And so I just, you know, kind of looking to you, do we need the strategic plan, or do we just need to go and talk to people?
My biggest concern is we don't have the bandwidth with our staff to manage those. We just handed out, 20, how many grants? 20?
Yeah, once all the contracts are signed, and we're waiting on a few of the out-of-school time program contracts to come back because they had to run it through their legal or their councils or boards. But once they're all executed, in addition to the ones that we already had going, we'll have 24 active contracts that we are going to have to monitor, and on the fiscal side and on the program side, and reimbursement requests coming in and disbursements to make, and then all of the other stuff that we're going to keep moving with. So if we did it, something else would have to be put on the back burner, because we're not strategic planning experts. I mean, we could do it, but it would be a stretch. And we did issue the ITB, and the reason that the bid included the sessions is because it was a requirement that they include those sessions. So I just want to make sure that
Yes.
that was why they put it in there, because we told them they had to. So.
Yeah, I remember making that motion, and I understand. I guess I need, you know, I've dealt with organizations, and if we do a contract and we send them out to do these conversations, are we going to listen to them?
But they can't make us do that.
I would hope that the board would be part of those those sessions, because it's you all that the community really wants to convince.
So unfortunately, because my delegate isn't here tonight. She probably could speak on this better, but I wanted to just connect some dots here quickly. We have an interim strategic plan that's sitting out there that has themes and has tasks, one of which we voted on tonight to implement the ITB that's in there. There's a children's summit in there, inaugural children's summit. There's all kinds of structure and design to it. Not all of it has occurred yet. Would this reframe that? Is that like, we need to take that to a new level, or is that not good enough for now? It says 22, 23 at the top. I understand 23 is ending at some point, but does that mean that are we investing in a 5-year strategic plan, 10-year strategic plan, or another 1 year? And the community input on it, is it about how far along are we already in our current plan, or is it, you guys need to go back to the starting page and start all over because this sucked? I'm a little lost on perspective about why are we re-engaging when we're just starting on the current strategic plan?
Well, because the current strategic plan that we have is just a 1 year. It was just to get us going because we needed to start moving on some things because we were getting a lot of pushback from the community saying, you know, what are you guys going to do? And so we needed to be strategic about it and say, okay, here are the things we're going to do. Here's when we're going to do them. Here's how much we're going to put to each of these. So when that is done, then what do we do next year? And that's what I would like to have, is I'd like to have a 3-year plan, which is what the ITB was for, was to bid on helping us develop a 3-year plan so that we know what we need to be doing, so that the staff has marching orders basically from the board, so that we don't have to keep coming back to you every month going, well, what do you want to do this month? So that we can get the community's input. And the community may come back to us and say, oh, you did that all wrong. And then the board may agree or may disagree that we did it all wrong. Or you may want to say, this year is done, let's look forward. How do we want this to be framed? And that really is part of the process, and the board would have to establish that, I would think, at the first meeting when we all come together for the first meeting of the planning process. And it is a process, and we did it was very rushed last time. We did a strategic plan in record time, and that's why it was for only 1 year. But things also change, and so we have, next up for us is our mental health initiative. And that's going to align with the mental health task force, with their strategic plan that Ernst & Young is working on. And so we've got some things going with that. But once we have that, if we have Help Me Grow going, we have out of school time programs going, and we have mental health programs funded, then what? And so that's really what we need to decide, and we need to have it all written out, and we need to have our rationale behind it so that when somebody comes to us and says, you need to be doing this instead, we have something that we can go back to and say, nope, we're doing this, and here's why, and it was thought out, and it was discussed, and it's got the backup data, and the community had input into it. The community said, yeah, the data shows that this is the biggest problem, but really the biggest problem is this little bitty need down here, because we have all kinds of funding and we have all kinds of resources to address this big need. We need to put the money in this bucket. So those are the kinds of conversations that we really need to have facilitated and walk us through so that we absolutely know what we're doing. And you can always change a plan, you just shouldn't change the goal. And so I'm a planner, and so it is very helpful to me, and we have weekly staff meetings, and we look at all the different things on the strategic plan, and are we doing this, and are we meeting our metrics? We need to have our work measured too. And so what are the things that you want to see from the organization? What are our deliverables? What's our to-do list? And we can do it without a plan, but successful organizations tend to have a good, solid strategic plan. And there is some value to having an outside agency do it, because the board will say things to an outside consultant that, they may not have thought about. It could bring out discussions that, that we may not even think of or be comfortable talking about, but they'll put it out there. You know, same with the community. They're professionals that are trained to do this. And I'm not advocating for one group over another. I'm talking about the actual process of strategic planning. Because I know it's expensive. It's a price tag, but it's kind of like having a good roadmap. You know, if you don't know where you're going, how you gonna get there? So.
And Madam Chair, I mean, and Tammy, and just in my response, I think we have a highly competent staff, you and Kim, who are strategic planners. And so when I see the pushback from me as a board member, it doesn't come from the end user, it comes from the providers. And they have a selfish interest. I mean, well, they come down because they get paid, they bring in revenue. And so I don't know if someone's hearing something different from me, but the pushback, you gotta put money out quick, you gotta do this, you gotta go, really becomes from the providers who all have a selfish interest because they're employed and they're bringing money to the organization. I do believe in plans, but I do believe in what I start, I finish. And I spent 12 months of my life, you know, whether it's going to Woodland or whether it's going with Ted Kersher or it's coming with all this strategic planning. And for me, I'm not saying that we shouldn't move forward with a strategic plan, but if I've already started allocating money and I don't have a strategic plan, then I've failed in my responsibility. And so in my opinion, I thought we had a strategic plan that we're going to follow through. And so, I mean, not to say that we shouldn't continue it, but I will say, for me, in my opinion, you know, those who are, people keep saying they want us to put out money. It's not the end users. There's not people who are coming, who are receiving the services, or who are yelling and knocking our door down for that. It's the providers who get paid every single day to provide the service, who are saying you need to hurry up and give out money. So, I mean, you know, I don't know if this is ready for prime time. Maybe it is, and you've studied it, but I certainly feel comfortable in what staff is, the capabilities of our staff. And the expertise, and we talked a lot about when we were hiring. When we talked about hiring Kim Krupta, we simply talked about Kim Krupta has the ability to strategic plan, to evaluate, to bring all these resources when we brought Kim to the table, when we had that evaluation. And so I want to give your staff the ability to do what you need to do. I mean, if you say you need a strategic plan, obviously you need it, but certainly I want to rely on the expertise that we brought within staff. And so I do realize that there are limitations. You can only do so much within, you know, an 8-hour work week. But I certainly, you know, just think that we have to be very careful in the amount of dollars that we spend that are not for direct services. And, you know, that's the problem I had with the previous vote on, you know, on the grow, on the phone calls. It's the problem I have when money is not, you know, feeding children, helping children, tutoring children. So if that's the wishes of what staff, I mean, that's fine. But I certainly think that, you know, we're allocating money, we have a plan, we put the buckets of money. We kind of know where we're going. I mean, we just have to make sure that we ensure that where we said that we're going, that we're going to go. And if we need clarity on that roadmap and from staff, I mean, I think that, you know, we accept that.
So the strategic plan that we have right now is just for 1 year, and we're almost done with it. And I know that you all had done some work and had some conversations with Mr. Kersher before I was brought on board, but the only thing that I got that came out of those meetings is a list of the priorities and some of the areas that you wanted to focus on, but there was nothing that I have found. So if I'm missing something, just let me know where it is and we can use that. But what we need, so that we have something to fall back on as an organization, is a plan that says we're going to do this quarter, and it's going to touch on these indicators, and here's how we're going to know if we were successful and who's responsible for it. So, you know, can we do it? Yeah, we can do it. I mean, I don't think there's anything this staff can't do, but that means there's something else that we're not going to be able to do. So we just need guidance from the board.
One of the other areas I have concern with regarding this, going back to Tim's comment of getting a robust, transparent, thorough plan, is we have of late, in my perspective, and the staff in particular of late seems to be getting a lot of slanted and accusatory and other biased comments and everything from in these meetings to on social media and other media of kind of between the proverbial rock and the hard place. And it has spilled over times into this board as a whole. And this is one of the advantages that I see of getting a robust strategic plan. One, we are coming to the end of the plan that we have currently, and I think we all could use some direction of where we're going from here. And I think to do it in a very transparent fashion that at least offers the public the opportunity to come and express their views and their opinions on things, and to do it in that type of a setting rather than seeing it pop up on various blogs and other things filled at times with misinformation and other things. I just am personally beginning to feel somewhat disturbed by that and somewhat feeling that if that is indeed the way the public feels, then we have an obligation to them to let them vest more and have more input into these things. If that's not the way the public as a whole feels, that would also be expressed in this type of a thing. But it would allow us to go forward past this first one-year strategic plan with some guidance and some input and some clarity, and would allow, honestly, the ability to look back to folks and say, we did go through this process. And in large part, we went through this process to afford you all the opportunity to provide your input to us and provide your opinions to us, give us this guidance for consideration. You either chose or did not choose to do that, but be that as we may, I think I used the term the other day in the discussion we had about this, as well as the adage that is common to many weddings of speak now or forever hold your peace. And having spoken, good, let's go forward. But to keep having this speaking taking place one-sided without an opportunity to provide correct information and things does no one any service. And so I know it's an expense, but I think when relative to the clarity that this board would benefit from, the clarity that the public would benefit from, gaining some confidence, some public trust as we are expending these large amounts of money, that it would be beneficial to all parties to proceed in that way.
Madam Chair, to Dr. Northrop's point, I think that, I asked the questions to begin with, but as we move forward, we need to hold ourselves accountable. If ID Group can talk to us about what are our strategic focus areas, what is our intention and what are our goals, and what are the key performance factors, so that the public can say, they said they were going to do this, they either did it or they didn't, and that'll be on us. And I think that to the point that we're making, that some of the public has not been happy with us thus far, but at least that way we're putting it out there what we're about, who's going to be responsible for getting it done, which is always the piece that many strategic plans miss, is who is going to be responsible. And then, did we do it or didn't we do it? And I think I'm ready to support it.
I'm ready to support. I do agree that an independent outside consultant is better than having y'all do it, because y'all have a lot on your plate already, and I think that would help the public perspective as well. So.
Madam Chair, I appreciate the comments, and just my nonprofit background, anything that's got a $112,000 802 price tag on it is big. And I always think of, is there a better way to do this without spending this type of money? And I said this in our budget committee, And I understand Dr. Northrup, what he said in our budget committee, the same thing he said tonight. And then the same thing I said in our budget committee was, if I'm on Boys and Girls Club or Gulf Coast Kids House or what, any other nonprofit, would a board vote to spend $112,000 on a plan? And the answer is no. And we've got governmental tax dollars, so I feel like we have these dollars and we can allocate it. But is there a better way to do this without spending these dollars? I was thinking earlier with our first Help Me Grow proposal, the county commissioners have a committee of the whole workshop. It's like we need a committee of the whole workshop where we can hear from nonprofit and learn about these before they get to our table. Too often we get it at the board or a committee meeting, but we haven't had really full time to vet it, to understand what we're doing. And Mary Ann, thank you for being here. I think you were a tremendous help in my eyes in voting yes for this program tonight. I don't know if I would have been there without the trust of having you being here and explaining that to me. So this plan can we do this? Do we have time to do this? If we held, I would be in for a weekly, every Thursday around this community from Century to wherever, to be there to listen to the community input and write it down, pair that with our needs assessment that was very well done, and see what we can come up with without spending $100,000. So, but I understand what they are, and I appreciate the IDEA group for putting this forward. I think they're a wonderful organization. They've done a lot of comp stuff in the community with Gulf Coast Kids House, for one, with doing their planning session or their logo and their branding years ago, and I've always been appreciative of that. But I just, as one vote, cannot support this tonight.
Any other discussion?
David, would you be more comfortable if we had the groups to come and present? Because I know the ID group well, but I do agree with you that it may be better if they came and presented to this board and talked about it and we had more input. So, rather than kill it, could we table it?
I'd be for learning more. It's just the price tag gets to me, and maybe if I have a better understanding, maybe I can get there. But yeah, I'd be open to that.
Yeah, and I agree. It's not a direct service. The soft science of giving it. So I certainly respect where you are.
Madam Chair, a quick question, and it's procedural. Do our procurement policies have any direction on a one response? Do we have to do anything like resolicit, find out why the other bidders weren't interested? Is there any procedure we have to follow? Okay.
But I would say now, I didn't even think about that. I would say now, as much as I love ID Group and Mona's a dear friend, probably one responding or two in the procurement world would cause me pause. And I don't think that there's anybody that could compare to the services that they provide. But I certainly think with all of the groups that we have, that I probably would agree with Dave that we should extend the solicitation, but whatever you guys decide, I'm fine.
So I would hate to put the ID group on, but we do have some representatives here. I'm not sure if they're willing or would need more time to present or speak about it.
No, I wouldn't want to put them on the spot tonight. No, not at all. Not at all. I don't think that's fair to them. They're a great organization. They do a lot for nonprofits that I'm involved in. So I say that with trepidation. So Mona does great work in this community.
So we made a motion.
I see you.
In a second, do we want to table or do we want to vote? So is there a motion to table? There's no motion to table, so.
Dave, you got a motion or not?
I can see, I can count. So, I think they're there, so.
So,
If you got a substitute motion, make it. I'll second it.
I think I never did it.
yeah, there's a motion.
Yeah, there's a motion. You just have to have a substitute motion right now.
So.
Yeah, that's what I'm saying. You'd have
We
to
have a
have it, yeah.
discussion, so we are voting to approve the strategic plan. All in favor?
Which one are we, what are we approving? The option one or option two?
Option one. The motion from Dr. Smith was option one. All in favor? Aye.
Aye.
Any opposed?
Aye.
Aye.
2. So the motion passes. So we have nothing for programs for this meeting. On to the Executive Director's Report, Ms. Greer.
Oh, there we go. So some recent highlights. The governor's office is still way behind in making appointments. So Dr. Northup, thank you for hanging in there and continuing to serve. As I mentioned at the last meeting, we got confirmation from the governor's appointment office that until a member resigns or is replaced or reappointed, they're still on the board. So just wanted to let you all know that last I heard, they were still working on the appointments from 2020 and 2021. So we'll get there eventually.
Is that the governor's office opinion, or is that Attorney General opinion?
Opinion of, what do you mean?
If your term is up, but you keep serving until the seat's filled.
Oh.
Do you know, Meredith? Is that a?
That's an opinion of the governor's office. I did some research. There are no attorney general opinions on the subject, and there's no case law on the subject.
Okay, thank you.
So, Mayor, technically, Lonnie Wesley is still serving?
Yes.
Yes.
Wow.
Has he submitted a letter of resignation? Is that
No,
what
sir.
we need from him he's officially off?
Yes, until he sends us a letter, he's still on the board as far as the governor's office is concerned.
Madam Chair, I would think that maybe a letter from the chairperson asking the governor to make the appointment would help him in making this decision. And I don't know if that needs to be in the form of a motion, but
So I've reached out to Pastor Wesley. I've spoke to him personally a couple of times. He keeps telling me he's going to write a letter of resignation. And then when Kim spoke to him, he said, y'all need to quit calling me. I'm off the board.
well, I mean, my letter was not to him, it was to the governor.
So we're
I'm
just,
saying that we need an appointment. That's fair to Mr. Northup, and that's fair to Pastor Wesley for a decision to be made.
Just as an aside, the governor's office is getting slammed with requests for, to expedite appointments because, like I said, they're way far behind. And it's not just us, it's every special district, it's the board of governors for the university system, it's every appointment that the governor's office makes. They're just behind,
Absolutely.
so.
And I'll see him tomorrow night, and I will,
Awesome.
not that he'll listen to a blue Democrat, but I'll tell him tomorrow. I'm actually leaving this meeting going to Tallahassee, so
Good
I'll be there
luck.
at 7 in the morning.
Yeah, no, I hope he does expedite it. That would be fabulous. A lot of our colleagues would be very angry because they've been waiting for years. So.
Is it causing you a problem?
No, it won't cause me a problem. Okay. So, I'd be fine. So, like I mentioned earlier, we've executed the majority of the out-of-school time contracts. Huge thank you to Meredith for going through that whole process with us. I've said it before and I'll say it again. I think we have one of the best contracts in the state. It is on our website where you see things blacked out. That's where the name of the organization and their funding amount would be inserted. And then there are tons of backup. And so if you are interested, I would really love for you to read the contract because I think it's something we can be proud of. It is very tightly written. There are some things that we may want to tweak in the next round, but for the most part, I think it's really, really great because it holds the grantees accountable on both the fiscal side and the programmatic side. So I'm very, very pleased with that. And I think that moving forward, we're going to have a really easy time. Well, I say that, knock on wood. We're going to have a really easy time getting expectations set up front. And so anyone who's interested in applying for funding from us can go online and see what their contract will contain, the data that we're going to require them to collect, how often they're going to be required to report, that they have to agree to be monitored, and that we need certain assurances from them as far as background screening and certain policies in place and all of those types of things. If you can think of it, it's probably contained in that contract. So I just wanted to let you all know that it's there. The Family Resource Guide is going to be distributed in April, so we're very, very proud of that. I know that not everybody is a fan of publishing a resource guide, but I do think that once you see it, you'll be pleased with it, because as the team was going through the data that we were submitted, the contact information, it's amazing how much of it was out of date. So when this comes out, we will have the most up-to-date data out there as far as the organizations that are in business and have capacity and how to contact them. So I think that'll be something really nice to have in the community. The next thing that's on our current strategic plan, which is the last initiative that we have mapped out for this fiscal year, is a mental health RFP. And so we're going to start doing our listening sessions. I'm going to send out emails tomorrow to each school board member and county commissioner jointly, so that, spoiler alert for two of you, you're going to get an email tomorrow. But I really would like some input as to, dates that you may be available, if you want to participate, if you want to be there to hear this, because I know mental health is a really huge issue in the districts and in the school system. So we want to have those listening sessions in each district. I'm also asking if you have particular locations that you think we should use. The one that we do have set up already, I worked with the folks from northescambia.com, and they suggested that we look at Molino so that we can be right in the middle, because they said they'll begrudgingly drive north or south to get to Molino. So we're looking at the public library there. But the other ones we still haven't set yet, so we're going to get that information out. So we're working on that. We timed it accidentally. We timed it just perfectly, because the mental health task force that Representative Michelle Salzman has convened, they've been working on a strategic plan, and they are engaged with Ernst & Young as their strategic planning group. And I reached out to them. I've talked to them several times, actually, to their planning group, and we invited them to bid on ours, and they said, we don't have time because we're doing the mental health one. So, but we want to make sure that whatever we do, to the extent possible and practical, will align with what they found, because they're already doing a lot of the legwork for us, basically. But the focus of those task force meetings has really been to convene the leadership from many of the local organizations and the provider organizations. And so what we want to do is go and meet with the parents and the folks who are in the trenches, the folks who are actually working one-on-one with the students in the school district, counselors, teachers, police officers, parents, whoever that may be, because we want to find out what are the problems that they're seeing every day. What are some of the interventions that they're aware of, that they would like to see implemented? We just want to have these conversations so that when we put the RFP out, we don't do it too broad or too narrow, and that we can really cast a wide enough net to get some really good, innovative programs. We have already had one meeting with Dr. Smith. Thank you for your time with that. And with Allison Hill from Lakeview to talk about some ideas. To Dr. Northup's point, we're constantly being told, oh, you need to be doing this, you need to be doing that, you need to be funding this. And so when I get those ideas, when someone throws an idea at me, then I go to the experts who are in that field and say, okay, hey, I was told that we should do this. Can we? Would it work? How would it work? And so we're constantly exploring that. We have a meeting set up for one day this week, I think, this week or next week, with the folks from Baptist Behavioral Health Department. And then I've also had several conversations with Lindsay from Children's Home Society, because they work in that space. So we're doing all the legwork for that. So if you hear that we're out talking to folks, or if you want to be involved in those conversations, please let us know. Melissa's not here, so of course I'm going to say this now. We're hoping that Melissa will be our champion on this because I think this is something that really is part of the work that she's doing, and I know that she's passionate about this. So those are the things that we're working on right now. Some other things that are coming up, we have the Children's Summit. We're going to be submitting a budget amendment to you all next month, just to move some things around, mostly because we are getting far more interest on our money than we realized, and so we need to incorporate that revenue into the budget and then ask the board where you would like some of the other funding allocated. So part of that, you'll see that we have a much smaller budget than we had originally earmarked for the Children's Summit. And so we can give you more information about that once we have our next meeting. Thank you, Ms. Hightower, for being on that committee with us. We really appreciate your guidance on that. We have a really good committee working on the Children's Summit. We also, our lease, as I mentioned last month, our lease was coming due. So we realized that we need some space to have meetings. If you've been to our office, you know that we have no meeting space right now. We finally got a little room across the hall that we can meet in, but it's very small. So we need meeting space, and we're gonna have to start bringing some of the providers in so that we can train them on how to use SAMUS. It would be nice to have one place where everybody could come and we could do our RFP workshops. So I asked Dr. Meadows at the college if they have any other space available because we get such a good deal from them, and he actually does. And so I'm very excited about that. So we're pulling the numbers together for that. He said that there's a building that they want to dedicate to just not housing nonprofits. And so he could move us into there, and then we would have space for a copier. And so, it's the little things in life. So this would be wonderful if we can stay on campus. He said that he's looking at $10 a square foot is all he's going to charge. Just to give you some reference, some of the other places that we've looked at have been in the $30 a square foot range, and those are the cheap ones. I think the cheapest we found was $23 a square foot, but didn't include any of the utilities or overhead or cleaning or any of that. His is $10 a square foot all in. Like, I couldn't believe it. So I'm very happy to report that, and so that'll show up in the budget amendment as well, because we'll have to renew the lease, and so I want to run the numbers by you all. For now, we're just on a month-to-month, so we're still at the $5,000 a year basically. And the new space that because he showed us yesterday, it's already got new carpet and new paint, and he said we could just take a whole classroom and then turn that into a big meeting room. So there's room for the public, there's room for the whole board, so we don't have to chase down space every time we want to do a workshop. So
And technology?
And technology, yes. So we'll be able to have technology, and then he had the one big classroom that we could use for those kinds of trainings where there's not computers everywhere, and then there's a computer room on that same floor that he said we could have as well. We would rent it, but it's already pre-wired with all the computers. So and we would get the furniture potentially that's still in there, because he said they're not going to move it when they move those folks to a new building. So I was very excited about that. So I'm all about saving money. So there's that. And then we also started reaching out, early on I started having conversations about capacity building, because, people were saying, oh, the community's not ready for this. Well, then we put out our RFPs, and then we quickly found that our RFPs are pretty complicated because we're government funding, and so we have to have all these assurances, and every time we do one, it gets a little bit better and a little more robust. And now we're going to be doing them online. The ITB for the Help Me Grow will be completely online, the review and everything. So there's been a lot of talk about capacity building. And now that we've awarded all these funds, how are we going to make sure that some of these small organizations understand all the things that they need to submit as backup so that they can get reimbursement, what's allowable, what's not allowable, how do they implement their program with fidelity, how do you do amendments, all those kinds of things. So I started talking with other funders to try to find out what was already in the community. And we know that the State College has an institute Institute for nonprofits, and then we know that United Way does a lot of work. So I met with Andrea, I met with Laura. Laura decided that maybe she could convene a lot of the funders here locally, and then the group keeps expanding. But we're supposed to meet on March 21st, and all of the funders are going to talk about what we see as the needs for training for the providers to help to raise their organizational capacity. Is it on budgeting? Is it on reimbursement requests? Is it on training their staff? Is it policy development? All these kinds of things. And then we're going to try to figure out who's doing what in what space, and then what's still needed, and hopefully have one go-to or one coordinated system for increasing organizational capacity. And the good news is, then we don't have to do it. So there will be a really great resource for the whole community, and it won't matter if they're working in the children's services space or elder affairs or what they're doing. There will be one place where they can go for organizational capacity, professional development. So I was really, really happy that this is happening. So we got stuff moving. And then the strategic plan, two of the things that I hope we can consider, and I just wanted to put this out there so that you can start thinking about it, and then if you want to have conversations about what this means, because I would really love to see a couple of things incorporated into our strategic plan. I think grade level reading campaign could be a really easy, quick win for us, because I've mentioned this before, there are lots of books out in the community, and there are literacy programs here and there, but I don't think anybody really has their arms around who all's doing what and where. And I want to make sure that we have a good sense of what programs are available, because it's one thing to give a book to a parent. It's another thing to say, you know, are you able to read this, to make sure that they know how to read, and not in an embarrassing or threatening way, but make sure that they have the skills to make sure that they know how, you know, that they should read to their child for 30 minutes every night, that maybe they should discuss the book, those kinds of things. So we really want to do more to engage the parents and really push the reading component, because that speaks to the grade level reading, to get everybody reading by 3rd grade. And then last but not least, place-based programming. The Family Resource Center model, we had a call with a woman in Tampa the other day, and she talked about the National Center for Family Resource Centers. And there are some really good models, and something that they kept saying over and over is, if you've seen one family resource center, you've seen one family resource center, because they all look different based on what the needs of that community is. So we're going to start looking at more of the data, which we already know. We know where the places are that need the services the most, but we want to lay it out on a grid so that if anybody ever asks, why did the board decide to put this service here, we can say, because this zip code had these indicators and they were doing the worst, they were performing poorly on these indicators. So we went and talked to the people in that community, and here are the services that the community said they really needed. And so that's what we put in that place-based initiative, in that center. So that's one of the things that I just kind of want to get out there, because that would be a big shift in the way we're doing things. But that's something that's very common at many of our sister organizations across the country. So just wanted to throw those things out there so that I wouldn't be hitting you out of left field at some point when we're when we're doing the strategic planning, and I'm like, but we need to do place-based. So I've planted the seed. If you want any more information about that, please let me know. You know, if nothing else, I'm good for a long email with lots of hyperlinks to different resources. So that is it for my report. So thank you very much for everything. And Alma, thank you for reminding me. In your packets that we put up there for you, there's a brochure. They were inexpensive. Please do not comment on how they look, because I designed them. So it is not fancy. So this is what you get when you leave it to the staff. But we did pay to have them printed because our printer would not handle this. But we printed, I think, like 100 of them so that you could each have a couple of them. And so if anybody asks you, oh, what is the trust doing? What are you funding? That shows what was in our strategic plan for this year. Again, we didn't print a whole bunch of them, but if you ever are asked, at least that's something that you can hand to someone. And this information is all on our website. And then once we get the next strategic plan done, then we can release more information so that the public knows what's on our agenda moving forward. So thanks, Alma, for reminding me to do that. So, thank you.
Thank you. Ms. Fish, did you have a legal report? Thank you again for helping with those contracts. I know that was a lot of work, so I really, really, really appreciate that. Are there any public comment regarding non-agenda items? So no public comment. I did want to add that I have reviewed the committees for the board and have made the following changes. Mr. Peden will be coming off of the Personnel Committee, and I have appointed Ms. Sidoti to chair that committee. Mr. Peden will now chair the Finance and Operations Committee. Dr. Smith, did you also want to stay on that committee? Yes, sir. And I need 2 more volunteers for the program committee. I have myself, Ms. Patty, and Dr. Northrop. Any volunteers? Thank you, Stephanie. Anyone else? We'll add Melissa since she's not here. Melissa, you up. I'm gonna tell her you. This completes our agenda items. Is there any other further business from the board?
I wanted to let folks know that I do appreciate being able to come back and sit at this table, at this austere table, and just wanted to thank everybody again for all the work they do with the Escambia Children's Trust. It was a good idea. I retire in July, but my last day working is April 30th, so I probably will not be back here with you unless it's applauding you and cheering you on in my retirement. So congratulations on everything you've done, and look forward to seeing all the successes. We did open a new office on 9th Avenue, and Tori, thank you for coming. We loved the grand opening was well embraced by the community, and hopefully we'll see some more folks come to our service center over there on 9th Avenue. So thanks for everything.
Congratulations. So this completes our agenda items. As a reminder, the next board meeting will be April the 11th at 9 a.m. Since there is no further business, the meeting is adjourned at 7:57 p.m. And FYI, we did look at the Robert's Rule, and I don't have to have a motion to adjourn the meeting. So we are adjourning at 7:57. Thank you. Have a good evening.